Okay, so we just want to make sure that we welcome everybody to today's Family Medicine Grand Round session for September 29th. If you are interested in CME credit, the event code for today is 272047. You'll want to make sure that you do register for that credit through the CME office before midnight tonight. The information is there, but please be sure to contact me should you have any questions. Next slide. So we want to thank everybody in advance as we get started here. If you'll just make sure that your microphone is muted, unless you're engaging in the conversation, but otherwise, we really do appreciate the attentiveness and being engaged. And then also at the end of the session, I will be putting the evaluation link into the chat box. So if you can help us out with that, we would really appreciate that as well. And we are partnered with the South Texas Family Medicine Grand Rounds of South Central AHEC, and our mission statement is there for you to read. Next slide. So as mentioned, CME credit is available for those who are interested. You will want to make sure that you do view your transcript. You will need that transcript if you are interested in AAFP credit for these sessions. So on the next slide here, it does state that we do offer also one credit through the AAFP, but if you do have any issues with CME or AAFP, please feel free to reach out to me directly and I'm happy to help. Next slide. We do also want to mention that it is the goal that all of our FCM Grand Rounds presentations address the following nationally established physician core competencies. So those are listed there for you. Next slide. And we do also want to mention that Dr. Bazaldua has no financial relationships with ineligible companies to disclose for this presentation today. Next slide. And so Dr. Bazaldua is one of our PharmDs here in the department. She's actually going to be covering for us today the ABCs of health literacy, a basic introduction. So I'll let her get started.
Thanks, Nicole. And I want to, well, hopefully not need to apologize, but I just got a message on my computer that my internet connection is unstable. And I do have a few videos that I would like to share that really tell the story more than I can in words. So hopefully that works. And we'll get started. And by the way, I would like to make this as interactive as possible since we all have experience in practicing with or working with patients. But let me see, I'm hoping that this first video shows.
Hi, I'm Cassie. And I'm Blair. And today we're on the streets of New York interviewing people about their health literacy. Can you describe to me what hypertension is?
I'm guessing it's when you're really hypertense. I have no idea. No, but it sounds bad. I don't know that. Hypertension will be overactiveness in the muscles. Is it when you stress a muscle or something like that? No, actually in the mind maybe. Hypertension.
Hypertension is a mental disorder.
I don't have it though.
Treated with the proper medicine.
Hypertension would be overactive stressfulness.
The heart goes down. Something like that.
Do you know what angina is?
Angina. I don't know, but it sounds pretty cool. No, I don't know. I haven't done it to angina is. What is it? Sounds like something familiar, but I don't know.
Do you know what a stethoscope does?
Is it the same thing as a microscope or is it a totally different thing? Nope. No.
What's the first word that comes to mind when you think of your relationship with your doctor?
I lied.
Difficult. Sometimes they don't listen to what you're saying, or that they go so quick that you don't understand what they're saying.
The doctors don't spend enough time with the patients that come in.
He never spends enough time listening to what I have to say.
Doctors do not communicate with me enough. Because I ask him every time, what's the matter? He said, Jason, you're crazy. I went to my doctor. He said, no one takes me serious. And he said, next. They listen to your input in the beginning to figure out what the problem is, but after that, I don't think they care about what you think.
I'd like to see it more honest, open communication.
I don't think they always explain it to the patient in the same way that the patient would understand. Pro-doctor, but everybody is not the same level, and sometimes I think they need to explain a little simpler.
They went to college, they went to so much school, and they do not communicate. Obviously not.
Any comments on that? Dr. K, I see that you're online. Do you think that Spider-Man maybe had a mental disorder? He knew all the psych drugs.
I'm not sure this was a representative sample. Most of my people are not New Yorkers, and I don't have anybody who dresses up like Spider-Man.
Fair enough. All right.
Except maybe Dr. Falcone.
Thanks for participating, Dr. K. So I'd like to share a few other, I think this might be leaving without me here. Some scenarios for success that some of our UHS employees developed a few years ago. And they're true scenarios, and they just changed the names, I believe. So I just kind of wanted to share these with you because I think they are telling as well. And I just have a couple. So this is Miss Washington. She had a vaginal yeast infection. She was prescribed medication that and told by her doctor to take it with yogurt because it would help with the yeast infection. When Ms. Washington went in for her follow-up appointment, a strawberry was found in her vagina during the vaginal exam. This other scenario, this is Mr. Cherian. So he was given a medication to take once a day with food. The bottle had a picture of a hamburger on it, and Mr. Cherian did not take the medication because he could not afford to buy a hamburger every day. So simple mistakes, honest mistakes that happen almost every day. So these are labels that are found in our labels, prescription labels. What do you think this means? Any thoughts? So think about what you think that means if you saw that and you didn't know how to read. But radioactive were some suggestions, chills or shaking, medicine will make you feel dizzy, or take only if you need it. What it actually says is for external use only. What about this one? What does this mean? Oh, well, the answers are up there now. So, well, they're not the answers, but there's some suggestions. Some people thought that someone swallowed a nickel, indigestion, bladder, looks like Casper the Ghost, but it really means, or it says, do not chew or crush, swallow whole. So today I'm going to just basically talk about health literacy, the scope of it, and how it impacts health outcomes, and identify some tools to make our practice patient friendly. So if I can have maybe one of you guys kind of read this paragraph, any volunteers? Again, I want to make this session as interactive as possible. So these are words that are printed backwards. Any takers?
I can help. Yeah,
Thank you.
I am driving. I'm leaving clinic, but the National Action Plan to something health, speak
And the rest
to
of you can join.
engage. Oh man, I'm terrible at this.
That's okay. Thank you. Thank you for volunteering. So basically what I wanted
literally.
to share with this paragraph is that some patients, they actually can read some and they struggle, just like Dr. Pemberton was trying to read it. And at the end of a few minutes, they might read the whole thing because they can read it, but did they really understand? So I can probably, most of us can probably read this, you know, they are backwards, but it's just a sample of how some patients might be able to read, but at the end of the paragraph, can they read to understand and act on what they just read? And sometimes that's not the case. We cannot. So this is a Time Magazine cutout. This is an older version or an older magazine, but I think unfortunately a lot of the information is still true, meaning that for Latinos and African Americans, the high school graduation rate is worse than with others. So I'll show you a little bit of that. So yeah, I need to see if I can. So basically, I took some information here from locally. So I just picked a few zip codes. So 78209, the graduation rate is about 94%, average income $134,000, compared to 78202, graduation rate is 65%, and the average income is $25,000. Big difference. And we work in 78207 downtown, so those numbers are not any better. So 53% graduation rate, average income $35,000. So almost $100,000 difference. So 6 figures of difference within our city. So this is a website that I follow, and the last ones, the last data was in 2018. This is looking at cities with a population of more than 250,000. And they're looking at newspaper circulations, number of bookstores, library resources. They're basically looking at the literacy overall of cities. And so this is kind of a comparison here. This is kind of an overall result. So Seattle, Washington is the most literate, and then DC is number 2. And then I just picked out of 83 cities, I picked the ones in Texas just because we can relate to them the most. If you look at Laredo, just got on board there, number 83 with the larger population. So Laredo is the last one. We look at where we are, number 76 out of 83. So we're not a whole lot better. So Austin is the highest in Texas, probably because it's a college town. But El Paso has been towards the end for many years. And again, we are not that far behind. So if you look at this chart here, in 2006, we were number 64. And again, the higher, the worse we are. So now we went from 64 up to 76. And again, about between 80 and 83 cities. So we are not getting any better. And, these patients that don't graduate, or the, the students that don't graduate become our patients. So this is back in 2004, the Institute of Medicine actually started paying attention to this. And so some of the literacy basics, I'll go over them, but basically literacy and health literacy are different. Literacy is very common. It predicts health status. It's a major barrier. Shame is rather. It's associated with higher healthcare costs, and you can't tell by looking. So providers have limited training as well. The official definition is the degree to which individuals have the capacity to obtain, process, understand basic information and services needed to make appropriate health decisions. So basically, can patients get the information and then act on it? I do have another video here that I'd like to share. Let's see.
Low health literacy is a hidden epidemic in America. It causes needless suffering to millions of patients and their families, which translates into billions of dollars in unnecessary healthcare costs. Fortunately, this problem is starting to get national attention.
This is World News Tonight with Peter Tennant.
We're going to take a closer look tonight at something that is baffling millions of Americans: how to make their way through the thicket of instructions, the directions, and the guidelines given to them by their doctors. Now, about 40 million Americans are functionally illiterate, which means they read at or below the 5th grade level. They have an impossible time. But even literate Americans can be overwhelmed. Here's ABC's Jeffrey Kaufman.
It's estimated that 1 in 3 Americans struggles with what is called low health literacy. Many can't read, but many others are simply overwhelmed by the directions they're given from doctors and pharmacists. It used to be when you got sick, you went to the hospital and stayed till you got better. But with new drugs, new technology, and a never-ending push to cut costs, Patients are often sent home before they understand that what they have to do to take care of themselves.
Average Americans are struggling with modern health care. It's hard to be a patient these days. What's it like to be a patient? What challenges do they face? I want you to meet some people. They'll show us just how complex and overwhelming healthcare can be.
Well, I'm a kidney transplant. I've had the transplant for about 15 and a half years, but I've been sick forever. Okay, well, I take baby aspirin, that's up to me, cyclosporin, prednisone.
And when I make the doctor's appointments, I have to be sure that it doesn't interfere with his doctor's appointments, my doctor's appointments, or their doctor's appointments.
So you don't like to go to the hospital where they give you a lot of papers to fill out?
Paperwork to fill out.
Paperwork.
Yes,
Why is that?
because I can't read that good.
Because you can't read that well. What does it feel like when somebody hands you a lot of paperwork and you can't read?
I feel like you're in another country.
When you enter a doctor's office, the first thing, and if your first time patient, they're gonna give you a clipboard. Sometimes that is very discouraging for a patient who cannot read.
If I'm really embarrassed or confused or worried about things around me, or worried about my child being all upset, I would not be able to read things I normally would read every day.
You know, some of the words that the Sanji, gram, plastic, and all of that. What is that? Several things or one thing, or it's just a language that I'm not familiar with.
If the patient was transferred to that facility and to any and all insurance companies or other third parties paying or obligated to pay, this is not making any sense.
Do you have any idea what a normal blood pressure is?
No.
Any idea?
No. It's normal?
No, it's not normal. It's high. Have you or anyone ever had to sign a consent form?
Yes, I have hereby
Okay,
authorized.
See, you know these people. And even though they represent all education and reading levels,
I wanted to stop there for a second and just kind of want to get your feedback in terms of what you heard. You know, those of us that are older, we know that this is probably a very old video. Peter Jennings is there. He's long gone. And from what I understand, he was also a high school dropout himself. But I think the scenarios are still very relevant today. I see that almost every day in clinic. So any thoughts, any other, I guess, any other situations where you've noticed this in your clinic or with your patients? Or an example?
This is Dr. Fortune. I had a patient once who would crack open her antibiotic capsules and pour them onto her foot wound.
Okay, I haven't seen that. That's interesting. Yep. Or they pour, I've had some patients where we give for their child an antibiotic for an ear infection, and they actually put it in the ear. Any others?
Hey, this is Jordan Cashmit. I've had experiences with a couple times where patients will they're working on organization or trying to, reduce the amount of pill bottles that they're carrying around, and will put all their medications into one container. I've had some come in with, kind of like a Tupperware full of various medications, and they'll say like, oh no, this one, I know it by the look. However, sometimes I guess it changes. And so they'll be like, I don't know what this one's supposed to be for because it doesn't look the same anymore.
Yeah, so that's a disaster waiting to happen. So yes, that happens all the time. And then they don't know which one is which. Good. I think I have a few more minutes on this video, so I'm going to share that again.
they have one thing in common: low health literacy. It's so easy to make harmful and costly medical mistakes. Just listen to what they have to teach us.
So what you do, you come out of that room, that examination room, with this intelligent woman or man, thinking, God, I hope I don't make a mistake with my medicine, because I did not understand anything he or she said to me.
When your children have fever, what do you usually give them?
Motrin or Tylenol, normally Motrin because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4. Okay.
I would give her the 4 to 5, a tablespoon and a half.
So you give her a tablespoon and a half. Can you find where it tells you how many you take? The dosage?
Three a day.
Take 3 to 2 milliliters. And there's something I want to point out. I don't actually read this because I know what it says now. So if I had found it out, if it wasn't for I knew it, because I've heard it so many times, I would not be able to read that.
Okay.
Every 3 to 4 hours as needed for pain.
Okay. What's a milliliter?
I don't know.
The medication that was given to her was not explained. Well, we didn't use it. In fact, she ran out of her high blood pressure medicine, so she didn't take it. She didn't call me to tell me to fill it. So finally, I found out that she had not been taking it. I said, Mother, you can't do that. You have to keep taking that high blood pressure medicine.
And then it says discontinue. What does that mean?
How many times do you take these thyroid pills?
Once a day.
Okay, you take one of each of these?
Mm-hmm.
Okay, so you take 2 thyroid pills.
No, I take one. I more likely got them messed up when I got refilled.
And then, are these stickers helpful?
No, don't even look at them.
Don't even look at them.
What do you take that medicine for?
I don't know what it's for. He just puts me on stuff and you tell when I have it, I just take it.
Okay, I'll stop it there. Any comments on what you just saw?
I mean, I think we see that all the time in our clinic, those like very examples, especially when you ask them to bring out, did you bring your meds with you? And they open up their bag and they're like, oh, I take this for this, I take that for that. Sometimes they're completely wrong.
Yep, sometimes they're wrong, many times duplicates. So yes, so this happens very often. Let's see what I can. All right, so common errors associated with health literacy, communicating with the provider, medication instructions, follow-up appointments, health information pamphlets, informed consent. You know, there was another video that I ran into. It's a true story, unfortunately, but this lady had female issues, she said, and went to the doctor, signed some papers. They did a procedure and she came back 2 weeks and they told her, how are you doing since your hysterectomy? And she says, my jaw just dropped because I knew what a hysterectomy is, but I had not realized that I had signed papers for someone to take a, organ from my body. And so, just patients sometimes just sign because, they need to sign, but they don't know what they're signing. Giving a patient history, when you get a history, are you really getting the most accurate history? Are we in the same understanding? Just getting to clinic can be an issue if they have low health literacy. So we used to have a clinic just across the street where there's 3 buildings, and the 3rd floor from building 1 was not connected to building 3. So just getting to our clinic was an issue. So basic number 2 is very common. So unfortunately, we run into this all the time. There's a national assessment that was done years ago that, just wanted to share here. So basically, to be in a healthcare system, to be navigating the system, we have to be proficient. But what this assessment told us is that about 36% of the population scores in the lower end of basic or below basic. So 14% could not even circle the date of a medical appointment. So as many as, this is kind of reiterating, as half of the US adults have limited literacy skills, and 9 in 10 have limited health literacy skills. So again, it's very common issue that we run across. And people that are higher risk are the elderly, those with limited education, members of ethnic minorities, if they don't speak English before starting school, if they're unemployed, or if they are insured by Medicare or Medicaid. So do we see any of those patients? Do you see any of those? That's almost a silly question, right? Because I think most of our patients fit this category. So at least in our clinic where we're at downtown. So, you know, I've done a little bit of research with health literacy. And so there are some tools to measure health literacy. And so it's basically low, marginal, or adequate, depending on which test you use. Some of them are easier than others, but basically just trying to determine where their literacy level is. Usually there's, you know, it takes time. So Dr. Chu actually developed 3 screening questions, and she found one that was good enough and validated to actually determine whether they had low health literacy or not. And the question is, how confident are you filling out medical forms by yourself? If they say somewhat, a little bit, or not at all, they were all considered low literacy. But essentially, the general recommendation is to basically talk to everyone with language that is very clear, no matter what their literacy level is. They call this universal precautions. So kind of similar to the, you know, minimizing the risk of spreading bloodborne. So basically talk to everyone in simple terms, in lay language that we can all understand. I have a question here. What do you think is the answer? Which of the following is the strongest predictor of a person's health status? Is it age, income, literacy skills, employment status, E, education level, or F, racial or ethnic group? So strongest predictor of a person's health status. And the keyword is strongest. So I usually get all kinds of answers here, but since we're talking about literacy, the answer is literacy, even though all the other ones like age, income, employment, educational, they all are important and they all can predict, but the key was strongest, and it's literacy skills. Number 3, health basic number 3, literacy is a predictor of health status. So there is no question in their study after study linking literacy and outcomes. So stronger than income, employment, education level, and race. And these are just some examples of some studies linking low health literacy to overall poor health status. There's been some studies in glycemic control. So patients with lower literacy have lower glycemic controls, less healthy behavior, so they don't wear their seatbelts or get their vaccines. And they also have more hospitalizations. So the question here is, what about mortality? Does it affect mortality? And this study kind of answered that question as well. So looking at the literacy level, you can see that the low literacy had a mortality rate of about 39.4%, round that up to 40, compare that to the green, the adequate, 18.9, so we round that up to 20, so that's twice as much there. But after adjusting for demographics, socioeconomic status baseline, so maybe that has something to do with it, but what they found at the end is that they still had a hazard ratio for all-cause mortality of 1.52. So the answer is yes, it can affect mortality as well. This was in the elderly population. So people with basic or below basic literacy levels were 5 times more likely to misinterpret their prescriptions. And I see that all the time, unfortunately, still happens on a regular basis. So they make mistakes with their prescriptions. This is an example. Did you guys catch the on the video? The lady gave the daughter, the child, I believe it was a tablespoon instead of teaspoon. And if you recall, the teaspoon is 5 milliliters and the tablespoon is 15 milliliters. So it's a pretty significant difference. But if you have a prescription that says 1 teaspoon by mouth 3 times a day, and the patient goes home and they see all these in their kitchen drawers, which one would be the 5 ml teaspoon? And yes, it is a trick question because you wouldn't know, right, unless you measure it. So how many or how much do patients forget about what the doctor told them as soon as they leave the office? 80%, 50%, 10%, less than 10%. So the answer is yes, 80%. And unfortunately, from what I understand, out of the 20% that they do remember, 10% or half of that is wrong. Health literacy, basic number four, shame and stigma associated with limited literacy skills, and they are major barriers to improving health literacy. And this is just a very brief video talking about this. This is Mrs. Walker.
Like the embarrassment, the shame, I mean, it's just overwhelming. It really is. It paralyzes your thoughts completely to think that you may say something or something is put before you to read and you can't read it. I mean, you live with that on a daily basis.
Limited literacy has also been associated with higher healthcare costs. So that's something that we're all interested in everything, right? But higher costs is not good. This is a study that was done years ago by Dr. Barry Weiss. He looked at, because the Medicaid population is kind of a close population in terms of the healthcare and their spending. He looked at pregnant women, and this is older study, but what he found was that the patients with lower health literacy had a cost of about $10,688. I'm sorry, $28.91 compared to, so I apologize. The ones with the lower health literacy cost more. So $10,688 versus adequate literacy, $28.91. So basically the more literate, the less cost. This is a more recent study also basically comparing health literacy levels and the medical costs for these patients. And so what they looked at is over 92,000 veterans from 2007 to 2009. And looking at literacy levels, the adequate population had a cost of $31,581 compared to the adequate of $17,033. So over 3 years, they estimated that it would be $143 million, which is more than those with adequate health literacy overall. And this is just a different way to look at the increased cost for patients that have inadequate literacy versus those that have adequate literacy. So it affects health outcomes, it affects mortality, it affects healthcare costs. And along with costs, more hospitalizations. So 6% more hospital visits for those that have lower literacy, and they also tend to stay in the hospital longer, at least in this study, 2 days longer. You can also you can't tell by looking. This is, I thought, an interesting study where they found that 58% of patients with reading difficulties had never told their spouses. So for those of you that are married, do you know whether your spouse has adequate literacy levels? I thought that was interesting that some did not. Physicians could only identify 20% of their patients who were at the lowest literacy level. This was in a OB-GYN population. And probably because patients tend to hide it very well. This is Mrs. Walker talking about that.
One of the things that most of us know how to do is to hide it exceptionally well, because it's a terrible embarrassment, and the shame that goes with it is devastating. So the last thing in the world you want an intelligent doctor to know that you have any kind of problems other than the ones that you're there to see them about.
So this is something that we and some of my colleagues have been working at. This basic says that health professionals and staff have limited education, training, CE practice opportunities to develop skills for improving health literacy. We've been teaching health literacy to medical students for the last probably maybe 4 years or so, not long enough, but we're working on it. And by doing this presentation, hopefully, it's not that you don't know this, but hopefully it'll bring more awareness to be more careful about really talking to our patients in a way that they understand and confirming. So these are some recommendations. First, recognize that it's a problem in our population. Some ways to consider that, to realize that there might be a problem when they say, I forgot my glasses, or I'll read it when I get home. they give the literature to family members perhaps, or they just show a lack of interest altogether when you're trying to explain. And you can probably give me some other examples as well. Recommendation number 2, create a shame-free environment that is patient-friendly. So be helpful, answer the phones in person as best as we can, help patients complete forms, review instructions, encourage questions. And I apologize, looks like my slides are in automatic mode. And then simplify signs. I know the old building that we had at otolaryngology, and then underneath it had ear, nose, and throat. But when they translated to Spanish, it basically said otorrinolaryngología, but they didn't translate into lay terms in Spanish. So, you know, simplify your signage in your environment. Develop easy to read materials if you do get the privilege of working on that. Clearly incorporate health literacy into accreditation standards. I think we're slowly getting there. Simplify medication use and instructions. This is a label that was developed by one of my colleagues in internal medicine, Dr. Kripalani. And I know some of the pharmacies like Target is kind of working on simplifying the labels, but we still have a lot of work to do. So this is just a study where they looked at the accuracy of some dosing tools, and what they found was that the spoon is probably the worst, the household teaspoon, but the syringe is 92% accurate, and so is the cylindrical spoon. But if you're dosing liquid for a child, probably B, or the oral syringe is better, because with the cylindrical spoon that your child might fight and you might spill that easier than with the oral syringe. So use the right tools. Recommendation number 7, improve your communication skills. You know, I think we, at least I remember when I was in college, I went to some courses to learn medical terminology. And so I had to learn that. But then when I started practicing, I realized that I have to go back and revert to lay terms so that my patients can understand. Even in Spanish, we always say, oh, I'm going to take some medical Spanish. The patients don't understand medical Spanish. They understand, you know, just lay terminology. So improve your communication skills. 10 tips for better communication. So showing empathy, first of all, be an active listener, use language that is simple, slow down, avoid information overload, and include family and friends when you are you know, giving instructions. Tell stories. You know, I always tell the story of this was apparently a situation that happened in California. There was a Spanish-speaking mom that had a child with seizure disorder. She took her to the emergency room and she was prescribed Dilantin. And the bottle said, take once daily. And the mom apparently only read Spanish. So she read once in Spanish, and the translation is once, which is actually 11. So the story is that she actually gave the child 11 capsules, and she, you know, died of an overdose with Dilantin. Number 8, understand cultural context. And that's very important everywhere, but especially here in San Antonio. Use show and tell. I always, whenever, you know, I have a patient, in fact, we did that this morning, a patient that we started on Victoza. In fact, I have it right here. We use this sample to actually show the patient how to use it. I use that when I use inhalers as well. So show and tell goes a long way. And then I had the patient teach back to make sure that I explained to him how to use a pen correctly, or you know, whatever recommendations I give, I ask the patient, can you tell me what the plan is? Can you tell me what we're going to do or the changes are, so that I can make sure that I explain that to you correctly. So it's not so that I know that you understood, right? So the onus is on us. So it's called a teach back method. And if they didn't understand the first time, then we actually try it again, maybe in a different way. And so that's called the teach back loop. And this is actually an evidence-based practice. The teach back method has been studied and has been found to actually improve health outcomes. I believe it was in diabetic patients where they found that they had better glycemic, better A1Cs when the providers use a teach back method. So it is evidence-based and I use it all the time. Granted, it does take more time because I know we use it and they don't understand. So you have to re-educate them until they get the information correct. And I just have one more video to show here.
We didn't choose to be this way. And we would never choose to be this way. And I don't know if they think about that one way or another, but I don't care who you are and how high or how low your IQ is. It's very important for people to be treated with respect. I don't care what your financial wealth is or any of those things. Respect is very important. It's very important. And if you take a person who has a low IQ, a little respect from them, and God knows they have so very little to hold on to in the first place. Can you imagine how much that person has diminished when they left out of that office? I mean, you want to melt into the floor.
So that was my last slide, and basically just wanted to end with just like what Mrs. Walker is talking about, just be respectful and do your best. And maybe some of you have some comments or questions about what you just heard or read. So any thoughts, questions? We have a few minutes, I believe.
I do have a question, Dr. Bazaldua.
Yes, ma'am.
So sometimes, like, when I'm starting a patient on a new medication, I'll tell them everything I know about the medication, how to take it, or maybe the top 2 side effects, and I'll ask them if they have any questions, and if they don't, I'll tell them, oh, if you have any questions, ask them at the pharmacy when you pick up the medication. Is that an accurate thing to say?
So I guess I always talk about, do you have any questions? And I do that. I forget to do the opposite, which is if you ask, do you have any questions? It's a close-ended question, right? So the answer is either yes or no. And, like Mrs. Walker says, she's embarrassed. She leaves the office and she doesn't know what they just said. So she hopes she doesn't make a mistake. And so we want to be more invited. And I usually try to remember to ask them, what questions do you have for me? What questions can I answer for you? And then the other thing I try to remember is, I just did a presentation yesterday on diabetes. And what I mentioned at the beginning is, I appreciate, I value our brain cells and what we remember. And so I always try to talk about what does the person in front of me, what do they need to know? As opposed to, yes, it's nice that they know all the the mechanism, the pharmacology, the kinetics, but do they really need to know that? So I try to minimize what I share with my patients and just what they need to know. Now, if they want to know more, then I'd be glad to share more. But what is it that they need to actually take that medication appropriately? To actually take care of whatever it is that you're talking about. So minimize what you share with them. Because unfortunately, they go to the pharmacy and they're also busy, and they also say, well, did the doctor tell you about this? Yes. Okay. Any questions? No. Next. So I think we all have to do our part, starting with, us, the providers, the people dismissing the patient when they go to the pharmacy, and then be available afterwards if they have a question after when they get home. So, and I think it's, I'm glad that we're at least providing some information, but I guess, choose what you choose to be picky, I guess is a word, about what you tell them. Does that make sense?
Yes, it did. Thank you.
Thank you. Anyone else have any other suggestions on that? And I think the biggest issue that I run across and that I hear all the time, I would love to talk more to the patients. I would love to do this show and tell. I just don't have time. I have 10 other patients that I still need to see. And, I think that's real, unfortunately. And I don't know how to address that. Maybe some of you have a better.
We do have, I don't know if you can see the chat box, but we did have a comment here. It says for certain medicines, it is useful to schedule a nursing visit with a health educator to check on administration, like for example, insulin and inhalers. So there was a comment about maybe scheduling something like that.
Thank you. And no, I'm not seeing the chat box. So thank you for reading them for me. But yes, that's a good idea. So yeah, sometimes, you have 10 patients on your schedule and maybe 10, 15 minutes each. And, you want to make sure that they get it right. So maybe like a nurse visit or an educator. So yes, thank you for that suggestion. Any others? I'm sure
Is
this was
there a single question we can ask to get a sense? I mean, you have that question that you developed with the Ali and Davidson measured for whether or not you take a medication. Do you have a single question or a series of questions that you can easily integrate into your routine?
Yes, sir, there is one. I don't integrate it just because I practice a universal precautions. I try to be as simple with all of my patients, but there is one that Dr. Chu developed. This is here. I hope you can see my slides here. So there's a whole bunch of questions that have been developed in different tools, different measurements, but she actually validated this question. And the question is, how confident are you filling out medical forms by yourself? And 0, extremely, 1, quite a bit, 2, 3, 4. So they answered 2, 3, and 4. Then that is very indicative that they have low health literacy. So how confident are you, Mr. Smith, at filling out medical forms by yourself? So if you really wanted to, you can do that. And again, I practice the universal precautions, which is trying to be using lay term, very simple terms with every one of my patients.
But that's not the case for the after visit summary, which is often multiple pages that are printed with standardized wording. And I don't know if in UHS is also in Spanish or English. Any suggestions for that?
Well, I can't agree with you more. I don't like that myself, but I will say that I know through Dr. Davidson that the pharmacy is actually working on a program that we've been using here. Is called the Med Action Plan. And what that does is basically organize the medications in kind of in a table format where, metformin, you're going to take 1 in the morning and 1 in the evening, or 4 tablets in the morning. So it actually has a time, and it also has a column for the indication. So hopefully that is going to be more helpful. The idea, and the reason we're not using it now is because it's not integrated into Epic, but the thought is that we actually get it integrated into Epic, so it's easier for us to use. So I'm hoping that will be helpful, but we'll just have to wait and see for that.
Thank you.
Thank you. Other thoughts or comments? And the question that Dr. Hyan was alluding to was a question that we've been studying, and we kind of developed. I don't know if it's developed because it's not, we kind of borrowed it from the pain scale, but it's a question to look and determine adherence. And it's a self-reported, but the question is, on a scale of 0 to 10, how good are you at taking your medications every day without missing a dose? 0 means you don't take your medications, 10 means you never miss. And the reason I studied that is because I know I work with you guys on a daily basis, and I know your time is precious and very busy, but you can't take 20, 30 minutes to figure out their adherence. But this question takes 14 seconds that you can ask your patients. And then it's just, it's not going to solve the problem, but at least it gives you an opportunity to say, okay, Mrs. Smith, if you're a 7, why is it not a 10? And then you kind of dig in some more if you have the time, and then figure out how we can help. Any other questions or comments?
Dr. Bazaldua?
Yes.
I remember you mentioned before that we can ask for patients to get visits for like education on how to administer insulin and inhaler instruction. Is that still something that's available in the clinic or?
Sure. You know, I usually have learners with me. I have pharmacy students, PharmD residents, and some of you guys rotate with me, right? And you learn how to use them. And so, you know, we are busy seeing patients, you know, at least most of the time, but there's usually someone available to kind of sneak out and do that quickly, hopefully. So yes, if we're available, just kind of, either you can text me or you can just stop by, and either the patient might have to wait if we're seeing another patient, but I try to be available as much as I can for those things as well. But at the very least, if it's a time where maybe we're not available, we're not here, but I would suggest that maybe, you know, one suggestion is, you know, these how to use devices are on the internet. There's, like I've shared with you guys on how to use inhalers. There's a use-inhalers.com website. But again, that takes time. If you don't have time, at the very least, I suggest you actually put on the prescription, please educate patient on device use, so that the pharmacist can be alerted that they really, you know, they should do that anyways, but this will help them to make sure that they ensure that they do that. And sometimes, you know, the pharmacy may ask the patients, you know, do you want to know more about this information, or do you want counseling? And because they're also in a hurry, they want to get home, they say no, but they get home and they don't know how to use it. So also encourage the patients, and I think like, I forget who it was initially, they say, if you have any questions, ask the pharmacist, but make sure that you accept the counseling at the pharmacy is when you can encourage the patients. Anything else? What questions can I answer for you?
Are pharmacists required to provide counseling when they're dispensing medications?
So they were for, I think it was called OBRA 90, because it was developed in 1990. And so the rule was that, yes, they are supposed to counsel, especially in new prescriptions. But I believe that's now not the case anymore. Oh, Dr. Davidson says yes still. Okay, so apparently yes still. Even annually on refills is what he's saying. So I guess I was wrong there.
So maybe we should encourage the like you said earlier, encourage the patients to say, please provide me some information about my meds.
Yes, absolutely.
I feel like they're imposing on their pharmacists.
Right, right. And they are, you know, the other thing, and we just talked about this earlier with Dr. Persani, about just reminding the patients that if they have, sometimes they're not taking their medications because it's costly, but, you know, in our system, we are very fortunate to actually have a pharmacy that can give them a copay discount, a copay adjustment rather, or a discount, or we have copay cards. So we will work with the patients, or at least in the pharmacy to work with them. But yes, in terms of understanding what to do with their medication, they should be counseled, and we should encourage our patients to ask about that. Thank you for the question. All right, it looks like we got 5 minutes. So if you don't have any questions, I thank you for participating, and hopefully this just kind of again, I don't think it's new, but just a reminder of how some of our patients have to navigate this difficult system. And, you know, I always, excuse me, I always equate it like, you know, I don't know anything about cars. So, you know, it's kind of like, you know, if I had to fix something, I would have no idea. And so it's the same thing with the health system, even though perhaps there's an engineer that he's an electrical engineer, for example, but he develops cancer. Well, even though he's a very literate person, he has no idea about healthcare. So even for them, he's literate, but health literacy is different. So we have to keep that in mind as well. Well, thank you again for your participation, and you guys have a good rest of your day.
Thank you, Dr. Balsa.
Thank you.
You're
Thank
welcome.
you.